Right now, we're spending twice as much on our healthcare to worse effects than other countries. We're spending 18% of GDP. And one of the things that is confusing about this is people are like, where are you going to get the money? Which is completely incorrect.
You'll be doing things you don't like doing in order to go on living, that is, to go on doing things you don't like doing, which is stupid. Better to have a short life that is full of what you like doing than a long life spent in a miserable way.
Hey. Welcome back, you guys. Thank you very much for joining me. So yes, Andrew Yang did have his CNN town hall. If you have been watching my stuff, thank you. You're the greatest. I appreciate it. Thank you, thank you, thank you. But you might be saying, Q, you've been talking about all of these presidential nominees. You haven't been talking about nursing-specific news. Where is my nursing-specific news? And I promise, I'm a nurse. Q the nurse. It's the name of the goddamn channel. You know why you here. Boo boo. But with that being said, these nominees are going to shape the future of our healthcare. As Q the nurse, my litmus test is Medicare for all. And that's what I'm talking about here. Andrew Yang at the CNN town hall, he gets to ask about healthcare and a few questions about healthcare, not just Medicare for all. I mean, he talks about Medicare for all. He talks about his son having autism. He talks about anti-vaxxers. Never heard that been asked to a presidential nominee. And then decriminalizing all opioids. Ooh, I mean, these are some hot topic questions. And like I said, I appreciated this CNN town hall. I thought it was really, really good. They asked him some legit questions. We were still trying to get to know who Andrew Yang is. I made an entire video about all of the UBI stuff because that's what everyone knows Andrew Yang for. But moving forward, Medicare for all. Is he for it? Is he against it? Let's find out. First question.
Jose Altamirano. He's a program assistant at Georgetown University. Jose.
Hi, Mr. Yang. Rising healthcare costs and the threat of losing one's insurance is a concern for many Americans. What is your position on Medicare for all, and how do you plan to address the challenge of providing healthcare for over 30 million uninsured Americans?
It's a great question. It's on the minds of many, many Americans. I'm in the Medicare for all public option camp, generally an applause line in groups like this. No? Right now, we're spending twice as much on our healthcare to worse effects than other countries. We're spending 18% of GDP. And one of the things that is confusing about this is people are like, where are you going to get the money? Which is completely incorrect. We're spending twice as much on other countries. If we channel our existing resources and negotiate lower drug prices, lower rates, we can get the access up and the prices down and make it so that the people that are struggling, it is immoral that in the richest, most advanced economy in the world, we are more stressed out about navigating our Byzantine dysfunctional healthcare system when our loved ones get sick or injured than we are actually caring for them and helping them get well.
Wow. Okay, look, listen. Bernie's my guy. Bernie just came out with a Medicare for all. He reintroduced his Medicare for all bill. Pramila Jayapal has put out a fantastic, comprehensive Medicare for all bill that many senators have signed, co-sponsored both those bills. And I think those are the path forward. Those are actually the policies that's going to be put into action. I really want to say for the majority of the progressive candidates that are going, just like Andrew Yang, right? I don't think Andrew Yang has his own policy out. I went to his website. He doesn't, but he knows where he wants the country to go. But that specific answer to that question is how everybody should answer the question of how are we going to pay for Medicare for all. He said it's so succinct. I love the way he answers these questions. He gets to the point. There's no fat, there's no fluff, right? He answers the goddamn question right away, just like with honesty and realness, and like it's just a fact. He said, it's wrong to phrase the question that way. That's not the right question. It's not how much money will we have to spend to get Medicare for all. How much money will we save when we get Medicare for all? He says we are spending the most money on healthcare in the United States, but our outcomes are shit. It's dog shit. Compared to other countries that are paying much less for their healthcare, our outcomes are crap, right? And I think that's how all progressives should answer, including Bernie Sanders. Bernie Sanders is the policy king. He is indeed the policy king, but I feel like people get him all of the time with how are you going to pay for it? How are you going to pay for it? How are you going to pay for it? And this is how you're supposed to answer the question. It's not how are we going to get the money to pay for it. The actual question is how much money will we save if we get Medicare for all? Love that answer. I love that answer to that question. And then moving forward, they ask about drug costs, right? Drug costs, very important, huge thing. the pharmaceutical companies are costing millions of dollars. This question is specifically about insulin. Let's see how he answers.
Student at the University of Maryland. She's been living with type 1 diabetes for 16 years. Annalie.
Hi. So the rising cost of insulin, along with many other drugs that are necessary to sustain life, is a problem plaguing many Americans that live with chronic illnesses such as myself. So this has led to many people taking desperate measures, such as rationing insulin, that have led to death in many cases. So what will you do to combat this issue?
I have talked to dozens, maybe hundreds of Americans around the country who've had to make terrible, tragic, horrific choices where they're choosing between medicine and food or medicine and food for their children, and it has to stop. Now, one of the virtues of this Medicare for All plan is that if we expand public access, we can get the prices for insulin and other drugs way, way down. One of the things I would stipulate almost immediately as president is, look, you have to charge the American people the best price you are charging other people in other countries. Because there are times when they are charging us 10 times what they're charging people in another country. And how does that make sense? So we have to make it so that people like you do not have to make those sorts of choices. And obviously, if you have medicine you rely on, you should be getting that without having to strain yourself economically.
So it's just a super simple question. And he says, yeah, when I get into office, we are going to have to negotiate that. And the only way when he says we are going to negotiate, the only way you can make that a reality if you are going to negotiate as an insurer is if we have single payer. That's the only way we can negotiate that, unless they make an actual law, pass a piece of legislation that says you can't be selling to Americans the same drug you sell to Canadians at 16 times the cost, at 500 times the cost, because of our insane laws that allow these pharmaceutical companies to hike up the prices whenever they want. Yes, I think single payer is the best way to go about it, because if you have just one insurer and that insurer be the government, they get to negotiate the prices, saying, all right, this company, this pharmaceutical company will not sell us insulin at a reasonable price, at the same price that they're selling to Canadians. We're going to go to another company, and that's how you get those insurance companies to deliver the meds at a decent price, at a price that they're selling to other countries, which is insane, right? It's insane that they actually do that here in the States. It's mind-blowing. As healthcare providers, you nurses out there, you know when you have a patient in the hospital and they say, I can't afford this medication, you have patients stay in an actual hospital days longer than they would, because we're trying to figure out a medication they can go home with, which their specific insurance company will pay for. Maybe I'm just biased, and I love the fact that this question was asked at a town hall, but they did. They asked Andrew Yang, what do you think and what are you going to do about these anti-vaxxers?
Charles, what's your question?
Good evening. What are your plans to address epidemics associated with people opting out of vaccines or anti-vaxxers?
Oh, well, I'm a huge champion of science. My father's a PhD who generated 69 U.S. patents for GE and IBM. And some people have taken to calling my presidential campaign the revolution of reason. And so if the science holds, which it does, that vaccinating young children is vital for the public health, and we just need to do a better job at convincing parents that that's what they should do. The tough part here is that we're in an era of the collapse of institutional trust, where Americans do not trust, we don't trust our government, we don't trust the media, we don't trust the schools, and unfortunately we don't trust doctors. And so when the doctor says, hey, get a vaccine, then parents are like, you know what, I think I might not. And so there's this massive rebuilding of trust that we have to earn with the American people across many institutions, and unfortunately, our healthcare establishment is one of them.
I do like the answer, but I feel like he skated kind of around it. He says, yes, we just have to better educate these folks. It's hard, right? He says, number one, we have to better educate these folks, but these folks don't trust the people where the education is coming from. They don't trust the media, they don't trust the government, they don't trust any of these things. So what's the resolution? We want to educate them, but the way we educate them is through these institutions, but they don't trust these institutions. I feel like he skated around that answer. But the general thing is, he's right. What else can you do, right? What else can you do? What I was hoping for is set a policy, something that says you can't go to public schools if you are going to endanger other students. And I know that's a state-to-state thing, but as a nurse, as a healthcare provider, I got to let you know that's just where I come from. That's no BS. That's just where I come from. like it's mandatory for you to get a health checkup before you go into school. It should be mandatory for you to get your vaccines, the bare bones ones, the ones that are necessary for all of us to keep away the measles, because we've been having these measles pop-ups in every single state, right? At Disneyland, at Disney World, like what is going on, right? How is this happening? How is this happening in 2019, right? We almost eradicated polio. Now we're having kids coming through with polio. Like, this can't be happening. So I'm in the camp where we need actual policy saying your kids can't go to a public school if they're not vaccinated. You can't go to these public places if you choose not to get vaccinated, because you're not, yes, you do have the freedom to not get vaccinated, but you don't have the freedom to infect the rest of the population. That's at least how I feel. That's the answer I was looking for, but I appreciate where he's coming from. Maybe he wants to do a little more, but that's what I was looking for. Moving forward with this, with healthcare, because they did go at him a few with the healthcare questions. Decriminalizing opioids. They asked Andrew Yang, and he has a stance where he wants to decriminalize some of the narcotics, some of these opioids that are causing this epidemic, this narcotic opioid epidemic. He wants to decriminalize them and them being used in safe havens per se. So let's watch the question and the answer, see what they say, and I'll let you know what I think.
Kia Jones, she's a student at Trinity Washington University, originally from Ohio. Go ahead, Zakia.
How do your ideas on the decriminalization of opioids differentiate between addicted individuals and drug suppliers?
It's a tremendous question, and I was put onto the need to decriminalize opioids. First, they're the facts, where 8 Americans are dying of drug overdose every hour. This is a plague, and it's so bad that it's actually reduced our nation's life expectancy for the last 3 years. Drug overdoses and suicides have overtaken vehicle deaths as causes of death in America. Now, the federal government was complicit in enabling this opiate epidemic because the government stood by while Purdue Pharma dispensed hundreds of thousands of OxyContin prescriptions as a non-addictive wonder drug, and now we're all grappling with the after effects. So when I was in Iowa campaigning, a high school senior came up to me and he said, there are high school seniors in my school that have fentanyl patches and are addicted to opiates, and how can we get them treatment when they're afraid they're going to get sent to jail if they step up and say, I have a problem? And so when I saw this, I said, wow, we have to do more to help get treatment into the hands of that teenager's classmates. And I looked into international examples. There have been countries, including Portugal, that have decriminalized opiate use for personal use. And the way they make that distinction is they say, if you have more than a week's supply of personal use, then we may treat you as a dealer or supplier or someone who's actually engaged in a criminal enterprise, and then it's illegal. But if we just catch you with a quantity that suggests that you are just using it personally, then instead of referring you to a jail cell, we refer you to treatment. And that is what we need to do right here in the United States.
So you want to decriminalize small amounts of opioid use and possession. Does that include heroin?
Yes, it does. We need to decriminalize opiates for personal use. And as you might not be surprised to hear from that, like I'm also for the legalization of cannabis. We need to remove that from the federal controlled substance.
So cannabis and opioids, including heroin. Any other illegal drugs you want to decriminalize?
It would be the opiates that are the most common, which unfortunately right now include heroin and fentanyl.
What about cocaine?
Cocaine, it would not be on the list of substances I would engage in this because the addiction has very different features.
Okay, let's move on.
I really like this question. I appreciate the question. I really like the way he answered it. Number one, because he started out by putting the blame where the blame needs to be, right? I hate people who start talking about, yeah, no, we need to fix the epidemic, but we need to just tell people to start saying no to drugs. Get out. I want nothing. I don't want to hear from you, right? Yes, obviously we want to teach and educate these children not to use drugs, But Andrew Yang, in the beginning of that answer, he said it's Purdue Pharma's fault. They gave us these meds. They pushed these meds. They gave doctors bonuses when they would prescribe these meds to patients. It is Purdue Pharma's. It is these pharmaceuticals' fault, right? They are at fault for this epidemic that are killing Americans at a rate that is now higher than car accidents. It is insane. It is insane, and I appreciate that's how he started out, by putting the blame where the blame needs to be. That's number one. Number two, the separation between if you want to decriminalize this, if you want people to use it for their own use, right? How are you going to decide if someone is a supplier, a dealer, or if they're just using it because now it's decriminalized? And just like in many states that have decriminalized marijuana for recreational use, you can have up to a certain amount. And once you pass that certain amount, you don't need that much. If you need that much, just buy some today and then buy some tomorrow after you used it. But if you have more than a week's supply of heroin, fentanyl, whatever he chooses to decriminalize, then that's when they decide that you're a supplier versus someone who's just using. That is, it's really, really, really well thought out. I think that's great. I would love to know where Bernie Sanders stands on this issue specifically, on decriminalizing opioids. I agree with him 1000%. I am on Andrew Yang's decriminalization train. As a healthcare provider, I think that's the best way forward. They have been, like he mentioned, Portugal has decriminalized many of the opioids, and their addiction rates have gone down, their suicide rates have gone down, their deaths from narcotics have gone down. If we can see it, it's happening before our eyes, why don't we just do what's happening in other places? The good things from other countries where they've already started these, what many would consider radical changes to our healthcare, right? I agree with him in that specific area. The last question on healthcare that Andrew Yang receives at this town hall is about his son who has who's on the spectrum, the autism spectrum. I think this is a great question. It really lets us know a little bit more about Andrew Yang's personal life, because I keep saying this because we don't know who Andrew Yang is. He's not a representative. He was never a senator. He's not a mayor. We don't have that public history of who Andrew Yang is. We're just learning him, getting to know him now. But this really opens up the door to who Andrew Yang is. Let's see what he answers, or let's see what he says to the question about autism here in America.
The University of Maryland. Go ahead, Emmett.
Mr. Yang, like your son, I am on the autism spectrum. And while I kind of speak for the other Americans on the same spectrum, I can say with confidence I'd not be speaking here today about support, the same support that the Trump administration has tended to cut funding for. Would you be able to elaborate on your plan to protect these programs, along with other programs that currently don't receive any federal funding?
Yes. Yeah, so in case you hadn't gathered, like Emmett, my older son is on the autism spectrum, and my wife and I figured that out when he was turning 4, and it was a massive relief to us, because as first-time parents, you don't know if you're, it's like, maybe this is perfectly normal. Maybe we're just terrible parents. Like, a lot of things go through your minds. But then when we realized that he was on the autism spectrum, it's been this tremendous journey for our family. And I know what families go through. We need to dramatically redouble and invest in helping families with children who are developmentally different or neurologically atypical. And as a parent of someone who is atypical, I now think atypical is the new typical. And so we need to be able to do more for those families. And as president, I would champion a federal program to help funnel money into the schools in our communities, and make sure that that burden's not on the states. This is a federal responsibility and a federal initiative I will be thrilled to lead. So thank you for your question, Emmett.
You say... And I think this is a really important follow-up question, because I know this is such a personal issue to you. You say you want to destigmatize autism. How would you do that?
Well, part of it is just that I'm so open talking about it. I'm fairly confident I am not the first politician or even presidential candidate with autism in their family. But for whatever reason, it's swept under the rug as something to be ashamed of, which to me makes absolutely no sense. I'm very proud of my son, and anyone who has someone on the spectrum in their family feels the exact same way. So that's for starters. But number two, then if we invest these resources, because right now part of the stigma is you feel like you have to provide more for your kid, and then you go to the public school and they're like, well, we can't help your kid. And then you end up feeling marginalized through that process, and your child does too. So if they show up to that public school and say, hey, great news, here's this whole suite of resources for your child, then we can alleviate the stigma in the most important way, which is actually when the parent shows up to the school with their child.
Andrew.
Again, great answer. And I think you can't fail at that answer, because no one outside of Trump and his cabinet would take money away from those who need it most, especially when it comes to, the most recent story with Betsy DeVos. They literally wanted to take millions of dollars away from the Special Olympics, number one. And number two, they tried to take 29 different initiatives away from literacy training for students in America. Like, it's mind-blowing what Trump and his cabinet are willing to do when it comes to taking money away from education. But this was a softball, but it's important. I think this is a softball because you can't answer this question wrong unless you're an insane human being that hates your fellow man. But he's right. You got to funnel more money into these in the public schools education systems, because when you do, I don't know, but the way he's explaining it, and it's just makes more sense. You have someone that's on the spectrum, you do know there's going to be a little more care when it comes to those students. And when cut with care comes more money. So that's why, as a parent for someone who is on the spectrum, you feel like you need to do a lot more, pay a lot more money for these students, for these children. So having that support system at the school, when you go to school and that school says, I'm sorry, I don't have anything for you, you need to take your kid 100 miles down to this East Bumfuck school because they have the actual facilities or the extra resources necessary to teach your child. That is a burden on the family. Now someone needs to just be dedicated to taking that kid somewhere where if you made it a federal issue and it wasn't just a state issue where some states care a lot and some states don't, if you made it a federal issue and made sure that all schools, all public schools, had the bare bones resources to take care of the children that are on the spectrum, it's a win-win-win. I think that was a great question and got to at least shed a little bit of light on who Andrew Yang is outside of a presidential candidate. All of these questions, I think he answered most of them well. I love the town hall, the CNN town hall when it came specifically to Andrew Yang. Like I said earlier, I did do a review, an analysis on how he answered the UBI questions, because that's what we most know Andrew Yang for. That's going to be in the comment section below. Let me know how you guys responded to this town hall. I thought this was one of their more successful town halls. I thought it went great. They asked the right questions. These are the questions I had for Andrew Yang. Moving forward, I am going to want to know a whole lot more policy things. But for a first town hall, I thought it was great. I think he answers the questions directly, succinctly, efficiently, and he's honest. He's honest about where he stands, what he wants to do. He's not afraid to be as progressive as he wants to be. He's not trying to play politics. He's being honest. He's saying, this is what I want to do. This is my plan. And this is how I plan on getting this done. I love it. I love it. I love it. Catch y'all later. Thank you guys so much for watching. I really do appreciate this. If you guys were informed or educated in any way, shape, or form by these stories, please hit that like button. If you liked my presentation of the news, I really suggest you subscribe and hit the notification bell so you know every time Q the Nurse drops some hot, fresh press news. Thank you. Catch you next week. Deuces.